Mary Mambo remembers in 1997 working as a nurse here in Nairobi. What began as providing food to who she thought were street children and later treating them, making their numbers increase by the day, led her wanting to know where they lived and the whereabouts of their families.
In every house they took me, there was a bedridden parent or parents waiting to die due to HIV and AIDS. Those are the times when HIV and AIDS were killing people like COVID. And these children were just going on the street looking for food to bring to their dying parents. Around here there was no hospital, there's nowhere to go, they didn't have money, so they were just waiting to die.
It is a situation that pushed Mary and her now late husband to sell their property, quit their jobs and move to Mukuru Kwa Ruben slums to support and care for people living with HIV/AIDS.
We continued with this work. Many lived, many died. But after 1 year, within that 1 year, I discovered it's not HIV and AIDS is not the major problem in Mukuru, killing people. Mothers giving birth were dying every day. Like every day I come in the morning, I was told we lost a mother there during delivery, we lost another mother there during delivery, we lost a child during delivery.
In an effort to also save mothers and children who were dying during childbirth, Mary brought the midwives together, urging them to protect themselves and visit her clinic so that they could help the mothers in a safe environment.
I told them, please, instead of delivering those mothers there, can you please bring them to Kana? Because of these mild complications which are killing mothers, PPH was one of the major killers of those mothers. But unfortunately, 10 of them were already infected because of the way they were delivering mothers without any, hard gloves, and they were just using the nasal blade to cut the cord, and they were cutting themselves, and all that. So they all died except 2.
The deaths of midwives, children, and mothers became a motivation to strengthen not only the environment but also improve the infrastructure to prevent HIV infections and to save lives.
As we talk today, 99% of our children they become negative. By the way, since we started our 3-bed, 1-room maternity, we have never lost a mother in Mukuru, in quote, here, in this. Might be may 1 or 2 passed on when we are having a Kenyatta hospital or elsewhere, but within this community, we have never lost a mother. And they were dying every other day.
Up until now, the Kana Center has the capacity to perform operations, especially for women in this area who often cannot even afford antenatal clinics. Margaret Nyambura tells us that she came here at 42 weeks pregnant, a situation deemed complex, but her and her baby are safe.
Like I was confused, like niko na ball na niko na sindano. Like mimi masiku zilikuwa zimeenda, siumu sifanyiwi chochote. Like nimekaa na imba for 42 weeks. Ndio nikafanywa scan nikapata mtoto amezidi. Ndio nikaamua tu nifanyiwe CS na mtoto alikuwa tayari ni mkubwa kwa tumbo. Mimi nabambika tu sana juu. Tuko wote tupo. The first day ndio nilikuwa normal, lakini sasa hii niko vizuri, siumwi, naweza amka nifanye kila kitu yangu, nioge, nipanguze mtoto. Then tulale.
Kana still depends on the help of Good Samaritans and non-governmental organizations to get medicine, beds and machines to continue to help mothers.
The global grant was about $79,000, and you can imagine this was happening during COVID. So we were able to ship all that equipment. We brought it in, and from the time we started the project, there have been about 1,321 deliveries done. And the highlight of it is that just this week, there were 2 deliveries that were done in the surgical ward. That was what we actually had started this project with the Kana Hospital for, and we've actually done it. So our dreams have now come into fruition.
Additionally, this aid has reached hundreds of children to get education in this area of Mukuru.
Our children here have gone to the high schools, they have gone to colleges, they have gone to the universities. Actually, one graduated her PhD last year. I went to US. Those children we started with today, this year, 3 of our girls are graduating from Daystar University. One is doing her master's in counseling and psychology. Actually, she's doing her internship at Kenyatta Hospital. The one is doing BSN, degree in nursing.
Robbie Omondi, K24 Health Beat.